All right. Well, thank you so much for that introduction. Again, I'm Kristen Knudsen. I'm from Northwestern University in the Center for Circadian and Sleep Medicine. I also want to briefly introduce some of my colleagues who are here with me today. First, Sarah Rittner, who will be my MC, who will be assisting with checking the chat. So again, if a question occurs to you during my talk, please put in the chat as you think of it. We'll pause occasionally for questions. And of course, at the end, we'll have more Q&A. And another one of my colleagues who's been helping organize these events and participate is Lindy, who I think she's here somewhere. Lindy Olive. So with no further ado, I will pull up my slides. So I do have some photos to share, I think. All right, Sarah, can you see those? Okay, since I see you, I can say that. All right, so again, today I want to talk about sleep. Sleep is my main area of interest. I do want to start with a big disclaimer, which is I am not a physician, and so I can't make medical recommendations or medication recommendations. I am a scientist and a researcher, but I will encourage you throughout this talk, if you have concerns about your sleep, that you definitely bring it up with your physician or healthcare provider. Don't wait for them to bring it up because they have lots of things they're going to be asking you about. So if you have concerns, it's something you should definitely raise. Okay. So the topics I will cover today include what is sleep. I just want to start with the basics. What is sleep? What is it supposed to look like? How much sleep should we be getting? Talk briefly about how does sleep typically change with aging. I will also mention, of course, sleep and cancer for this group. I will talk about what are some of the common sleep disorders, briefly, what are some of the consequences if we aren't getting enough sleep. And I want to end on a positive note by talking about what are some things we can do ourselves to try to improve sleep. Okay, so what is sleep? So before I get onto that, I forgot. So I wanted just to highlight the National Institute on Aging has some great resources on their website. I provide the link here and I'll show it again later on. And as mentioned earlier, these slides are available as a PDF afterwards if you're interested. Or so you could simply go to Google and Google NIA sleep aging and you'll be able to find it. And I do recommend them. So what is sleep? Is it just a period of rest for the brain and the body? And the answer to that, as we'll learn, is yes and no. There certainly is rest involved, particularly for the body, because we're not moving around, or we shouldn't be. But there's a lot actually going on in the level of the brain during sleep, which is what I want to talk about. So you may know this, but sleep is divided into two main stages. First is rapid eye movement sleep, or REM sleep, and then there's also non-REM sleep. Non-REM sleep is divided into three levels, in 1, 2, and 3. Stages 1 and 2 are lighter stages of sleep, and then we have what's called deep non-REM sleep, or stage 3. And this is kind of a period of rest for the brain because the brain activity slows down during this period. That doesn't mean it's not doing anything important. We actually think it's doing some very important things, including some maintenance of the brain that happens during this period. But then there's rapid eye movement sleep, or REM sleep. You may have heard of this because this is the stage associated with dreaming, particularly the more fantastical dreaming with flying and unicorns or whatever. But that's REM sleep, the crazy dreams. But what's interesting about REM sleep is your body is paralyzed. You cannot move during REM sleep, but your brain is as active during REM sleep as it is when you're awake. So this is not a period of rest for the brain. And we think what REM is doing, and one of its important roles, is related to memory and learning. And in fact, children and infants get a lot more REM sleep than we do as adults. And we think that's because of its important role in memory and learning and brain development. I want to give you an example of what a night of sleep looks like using a very simple color-coded circle, as you see over here on the left. So this is an imaginary person who goes to bed at 11 p.m. and wakes up at 7 a.m. And the blue shades are the different stages of non-REM sleep, and the purple is REM sleep. And there's a couple things I want to point out for a typical night, which is you start in non-REM sleep. Typically, you'll go into the deeper, I can use my mouse, deeper stages of non-REM sleep, the stage 3, where your brain is slowing down. You may have some REM sleep, and then you continue through the night, and there's a lot more REM sleep towards wake. So this is a key characteristic of sleep. You get most of your deep non-REM at the beginning of the night, and most of your REM occurs in the second half of the night. So if you're a short sleeper, if you wake up really early, you tend to lose more REM sleep, and you don't lose as much of the deep non-REM sleep. The other characteristic I'm trying to point out with this slide that I think is really important are these little red blips here. The red represent awakenings. And why I think it's important to talk about this is because I think there's this myth, at least I heard it when I was growing up, that normal healthy sleep is when you lay your head on the pillow, you fall sound asleep right away, and you stay sound asleep for 8 hours straight, and you don't wake up at all. Well, that is actually not normal. Everybody wakes up once in a while during the night. But if you are under the impression or the belief that waking up is a sign of a sleep disorder or a problem, then waking up might cause you anxiety. And now you actually, it's a self-fulfilling prophecy, and now you do have a problem because it is really hard to fall asleep when you're anxious or stressed. And I think this myth of waking up during the night being a sign of a problem has actually done more harm than good, because if somebody's worried about being able to sleep and then they wake up, they can't as easily just roll over and go back to sleep. So I do want you to know that waking up occasionally during the night is not necessarily a sign of a problem. If you can't get back to sleep and you're awake a lot of the night, then that starts to look a lot more like insomnia, which we'll talk about later on.
Kristen, I don't mean to interrupt, but I think do you by chance have something open on your screen? We keep seeing something that says, please move this window.
Yeah, I see that too, but
is that not on yours? Is that yours, Jasmine? I don't see it.
All right. Technical difficulties. We apologize. We have returned. Okay. So another aspect of sleep that I think is important to understand is what is regulating sleep? What makes it possible for us to fall asleep? And we can divide this into two different processes that I'm going to simplify for this presentation, but it's a good idea, I think, to understand the two of them. One is represented over here on the left with a clock, and the other is represented on the right with a hourglass. So starting with the clock, this is meant to represent our internal biological clock, also known as our circadian clock or circadian system. And this is the system in our body that determines when you sleep based on what time your brain thinks it is. So it's hard just to go to sleep in the middle of the day, at least the middle of the day that your brain thinks is the middle of the day. There's certain times of the day when the circadian clock will allow you to sleep. So sleeping during the daytime, like shift workers often have to do, it's much harder and you don't get as good quality sleep. So that's the circadian side, controlling sleepiness and alertness, depending on time of day. The other part of this clock, the other process that's helping regulate when you can fall asleep is represented by this hourglass. And this concept is simply the longer you've been awake, the easier it is to fall asleep. So if you think of an hourglass, you wake up for the day, you flip the hourglass, and sand starts to accumulate. The more sand that's accumulated when you try to go to sleep, the easier it'll be to fall asleep. And every time you fall asleep, it flips back over, so the sand falls back out again. So these are the two processes. And so optimal sleep will occur at the correct time of day after you've been awake for a long period of time. Then those two processes are in agreement and work best together. If it's ever the two are in disagreement, like maybe you've been awake for a long time, but it's the middle of the day, you won't sleep as well. Or if you've been only awake for a couple hours and you try to fall asleep, you won't be able to fall asleep as easily. So these are a couple of things to keep in mind when trying to regulate your own sleep and shoot for the best sleep you can get. So how much sleep should we get? Well, that's a good question. And so the National Sleep Foundation pulled together a panel of experts to try to ask this question and come up with recommendations, which are presented in this figure here. This is based on age, because sleep need or sleep duration recommendations is certainly thought to change with aging. We all remember or have been around babies and young kids. They sleep a lot more than adults, and they need more sleep than adults. But I think most of us here fall into the adult or even young adult has the same amount, and older adult range. So the dark blue box is the recommended amount of sleep that most people should aim for. The lighter blue is maybe appropriate for some people, but anything below or above is considered potentially a problem. So sleeping less than 5 to 6 hours or less than 6 hours is thought to be insufficient for the majority of people. And sleeping more than 9 or 10 hours on a regular basis is thought to be a potential sign of some underlying problem. So all of us here should be shooting for around 7 to 8 hours on average. I often get asked about napping and what about naps? And naps are somewhat controversial. They can be good. especially if they're short. So if you're very sleepy during the day and you need to be more alert or you want to be more alert, a short nap can actually help to increase alertness, 15, 20 minutes. And the reason you want it to be short is because longer naps will start to get into that deep non-REM sleep I described earlier. And then when you wake up, it takes longer for your brain to wake up to get back up to its active level, and you feel groggier and you're slower to be fully alert. And so if you want a nap to increase your alertness, a long nap will actually backfire on you because it'll take a little bit longer to get back up to your waking state. So, but a short nap, you wake up to your active brain right away and you can feel more refreshed and more alert. The timing of the nap matters too. If you want to take particularly if you have the time, you're not worried about being alert after the nap, then you can take a longer nap, but don't do it too close to bedtime because this comes back to that hourglass idea. So if you're flipping the hourglass, when you take a nap, it's going to be harder to fall asleep that night. And in fact, if you're having trouble falling asleep and you're in the habit of taking a late afternoon nap, I would recommend trying to skip that nap on a day when you don't need to be alert or do anything to see if that helps you fall asleep that night. I think I might stop here and ask, is there any questions we wanted to address before moving on? I see.
There was one comment from Danette. I don't know if Danette, you want to say it out loud, or I could just say it that it sounds like they had their sleep study done about a month ago and it was inconclusive. Oh, you're there, Danette. Did you want to?
Oh, wait.
Sorry?
I didn't know if you wanted to give your comment, or I didn't want to speak for you if you wanted to mention it.
Oh, yeah. What happened was that they want to do a sleep study because I'm on oxygen because I had COVID double pneumonia a year ago. So the doctor wanted to rule out if I still need to sleep with oxygen or not. So they did the sleep study, but because I have a little bit of PTSD because of, it's bad history of being in another hospital. So I only slept for an hour and it was too overwhelmed and I was too nervous. So it didn't work out. And that shows that I do have sleep apnea. So the doctors say that they can do it again for home. So that's what I'm planning
that's
on
what I
doing.
I was just going to ask you if your physician could prescribe a home sleep test where you wear it in your home to avoid the anxiety. And that's not uncommon to be anxious in a hospital and then you can't sleep. Hospitals are the worst place to try to sleep.
Oh gosh, yes.
Ironically.
Yeah, I did this once before in Florida, but that was before cancer and COVID. But at that time, I didn't have any scar tissue because I have fibrosis due to COVID, and I got hit with COVID 6 months after I had my chemo. So for that, it can be very extremely uncomfortable. So whatever the situation is, I hope that they can help me resolve it so that I can either get a CPAP and get rid of my oxygen. So I'm dying to get that thing out of my room, basically. Yeah. Yeah, it's overcrowded.
All right. Well, thank you so much. And I hope the home sleep test works out well.
Thank you.
All right. Well, thank you for that. I'm going to move on now to talk a little bit about sleep with aging. Some of this will probably not come as a big surprise to people. If I can get my slides work. Okay. So sleep does usually change as we get older. Sleep often becomes lighter, which means more of the shallower stages of sleep, less of that deep non-REM sleep, often less REM sleep as well. We often have more awakenings. So now instead of a handful of awakenings, they can be more frequent and last longer when we wake up in the night. The other thing that happens is that clock I talked about that controls the time of day that things happen, it starts to get earlier. So as we get older, we start falling asleep and getting sleepier earlier in the day and wake up earlier in the day. In fact, that process starts even earlier. If you guys know any teenagers or remember any teenagers, their clock is about as late as it can get with falling asleep and waking up. And then just as we age, it's just gradually moving earlier and earlier. And then, of course, sleep disorders like sleep apnea, insomnia become more common as we age. Now, this doesn't mean we have to live with it. There's still treatments and methods out there to try to improve sleep. And again, you're going to hear me say this a lot, to talk to your doctor to try to resolve or get assistance with any sleep problems if the tips we talk about at the end aren't sufficient for you. Well, what about sleep and cancer? I doubt anything I'm sharing today is going to be terribly surprising, but sleep disruption is very common in people living with cancer as well as their caregivers. It's estimated that as many as half of people living with cancers report trouble sleeping or problems sleeping, and this includes insomnia, it includes fatigue or tiredness. There's a lot of possible reasons that could lead to sleep disturbances with cancer, including physical changes caused by the cancer or by surgery, especially if pain is a result. It can be a side effect of medication or drugs or other treatments. As we talked about, being in the hospital is a horrible place to sleep. And stress, we mentioned early on, like stress, anxiety. This is always terrible for trying to sleep. They do not go well together. And so stress about managing the cancer or even having cancer can impair sleep, as well as any other health related problems that aren't related to the cancer. Any other comorbidities or conditions could also impair sleep. And caregivers as well, even somewhere between 40 and 76% of caregivers for people with cancer report experiencing sleep disturbances or sleep problems. And it's thought to be due in part to the unique responsibilities of being a caregiver. Again, stress and the stressors associated with it, and compensatory behaviors that are endemic to caregiving that serve as both precipitating and perpetuating factors for insomnia. So basically, the factors that can lead to initial sleep disturbance in insomnia and then maintain them over time, so it becomes a chronic problem. And even in survivorship, sleep problems can continue past the acute stages and treatments of cancer. A 2021 study by the American Cancer Society found that 51% of survivors with 9 years or longer continue to have trouble sleeping. Again, some of the similar reasons: stress or anxiety related to financial worries and medical bills, the recurrence of cancer, other health issues from cancer diagnosis, the treatment, and or chronic diseases could partially explain this persistence of sleep disturbances. There are ways to treat this, and we'll talk again more about treatment for both sleep disorders and other tips later on, but some suggested ways to treat sleep disturbance in both active cancer treatment as well as survivorship include mindfulness exercises, cognitive behavioral therapy, which I'll talk about more in a little bit, stretching, yoga, social and physical activity. A lot of these things, again, are targeting the stress and anxiety and managing that to keep it from causing or worsening insomnia or sleep disturbances. Yeah. So I'll move on to talk about common sleep disorders. So there are several sleep disorders out there. One is sleep apnea, insomnia. These are the two I'm going to describe in more detail. But other disorders include restless leg syndrome. This is where when you're lying down and you're trying to sleep, you have this creepy crawly sensation on your legs and you just feel you need to kick them or move them or get up and walk around. And it disturbs your sleep and makes it difficult to either fall asleep or stay asleep. Narcolepsy, which is a particular kind of sleep disorder associated with sleepiness during the day. And it's a problem of the brain switching between sleep and wake too easily and at inappropriate times. Often is also associated with cataplexy, which is loss of muscle control. Similar to the paralysis we see during REM sleep, patients with narcolepsy often experience that same loss of muscle tone, but not when they're asleep. And there are other disorders that are called parasomnias. It's kind of a category. One of these is sleepwalking as an example, but they're not as common. So I'm going to talk about sleep apnea and insomnia because they're both the two most common sleep disorders. They become more common as we age, and insomnia in particular is very common in cancer survivors and cancer patients and their caregivers. So obstructive sleep apnea is the most common form of sleep apnea. And what it is when you're sleeping, there are either pauses in breathing or complete cessation of breathing during the night due to a blocked airway. So this little cartoon over here on the right is showing you how this gentleman, when he's lying down, his airway, which is down here, gets completely blocked by the relaxation of muscles and tissues by the back of his tongue and his upper palate, so that air cannot get through. And this causes gasping, it causes awakening, it causes really loud snoring. So if anybody's sleeping near somebody with severe obstructive sleep apnea, they know that this person is not sleeping well. They're not sleeping well. And it's very common, and it has important health consequences. So who's most likely to have apnea? Well, we estimate at least 18 million people with apnea. It's more often men, especially at younger ages, than women, but I want to emphasize that does not mean women never get it. We don't want to rule out apnea in women just based on gender alone. It's more common in overweight individuals, but again, not entirely. And there are certain groups, particularly East Asian populations, where you see sleep apnea at very lean body sizes. So it's not just, again, not just a condition for people who are overweight, although that is a risk factor. It's associated with high blood pressure. Could be a little chicken and the egg. It's people with high blood pressure have apnea, and people with apnea could go on to develop high blood pressure. And as you can imagine, it does have consequences. I don't think it's controversial to say that not breathing is not good for you. And what happens is oxygen levels in your blood drop because you've stopped breathing, and this elicits a bit of a stress response, particularly in the cardiovascular system, and the body wakes you up, causes like I said, a stress response to try to get oxygen in and get you start breathing again. So it's associated with a lot of awakenings and low blood oxygen levels. And in addition to the heart problems, as you can imagine, with being woken up multiple times during the night, you're very sleepy during the day, and that has risks as well. Not to mention poor quality of life. There are treatments for sleep apnea out there. The most commonly prescribed one, which is in the picture here and was mentioned earlier, is called positive airway pressure, either continuous or BiPAP, which is just, it looks lovely, but what it's doing is pushing air into your airway to keep it from collapsing. So there's no drug interactions or to worry about. The most common side effect is just the drying out feeling, because if the air is not well humidified, you start to feel like your nasal passages and throat gets a little dry or sore. We often do also recommend some behavioral therapy, such as avoiding alcohol, because that makes the apnea worse. Smoking, certain sleep medications in some individuals could make your sleep apnea worse. And again, if overweight is thought to be one of the underlying reasons for the apnea, losing weight can help minimize or reduce the sleep apnea symptoms. Now, even though continuous positive airway pressure or BiPAP are the most commonly prescribed treatments for apnea, honestly, a lot of people hate this device. So there are other alternatives out there worth trying, including a dental appliance. So it's something you put in your mouth during sleep that pulls your jaw forward to try to keep the airway from collapsing and getting blocked. Some people much prefer those dental appliances than the mask, and it can reduce the apnea as well. There's a newer treatment that was developed in the last few years, which is a device that gets implanted into your upper chest and stimulates the nerve, the hypoglossal nerve that keeps your airway open and patent, to keep it from relaxing too much, to prevent it from collapsing during the night. And then in some individuals, surgery to modify the airway area can actually help, if indeed the cause of it has to do with something that can be corrected with surgery. Not everyone's apnea can be corrected with surgery, but in some it can, and it can be very successful. All right. Moving on to insomnia. So the symptoms of insomnia are trouble either falling asleep, or trouble staying asleep, or waking up really early and not being able to get back to sleep, or any combination of those. In addition to classify as insomnia disorder, there has to be some daytime dysfunction or impact on your daytime functioning to be considered insomnia disorder. And in order to also be insomnia disorder, these symptoms have to have lasted chronically, I think at least 3 months. So many of us experience symptoms of insomnia at some point in our life, particularly high stress times. But insomnia disorder develops when it becomes chronic, where you're not able to ever recover and start sleeping well again without treatment. And as you know, the stats say here, approximately 40% of adults at least experience occasional insomnia symptoms, but 10 to 15%, which is not a small number, on a chronic basis, meaning at least 3 months, experience insomnia. We know, I can't even see the bottom of my slide, those more likely to have insomnia, I believe older adults, women, as we talked about, patients with cancer and their caregivers are more likely to experience insomnia. So treatments for insomnia, the first recommended line of treatment is actually not medication. It is a more behavioral management, particularly cognitive behavioral therapy, which I'll describe in more detail on the next slide. Also relaxation training, similar to what we discussed before, with the idea to try to, if anxiety or stress is part of the underlying cause, that relaxation can help reduce that and facilitate falling asleep and staying asleep. There's also a method called mindfulness-based therapy for insomnia. And what this one is doing is it's combining the methods in the cognitive behavioral therapy for insomnia, which I'll talk about in a minute, with mindfulness meditation practices to improve insomnia. And it's also shown to be very successful. For some individuals, medication is prescribed to help, particularly with falling asleep, although with some medications are meant to help you stay asleep. There are both over-the-counter as well as prescription medications available, but again, these are not considered the first, shouldn't be the first attempt. Now, we'll, and again, with any medication, even if it's over-the-counter, talk to your doctor first, because you do want to avoid any potential interactions or risky side effects. So cognitive behavioral therapy for insomnia. This is a structured program that is requires a specifically trained provider. So that is one of the challenges with CBTI, particularly years ago when it was originally only all in-person visits with this provider, I think on a weekly basis. However, in recent years, they have started developing more online delivered options for CBTI. So it is definitely something worth exploring if you think this would help you or someone you know. And the overall goal of CBTI is to try to identify and replace those thoughts and behaviors that are causing your sleep problems with thoughts, behaviors, and habits that will promote good sleep. So taking out the bad thoughts and replacing them with healthy sleep thoughts. And the reason this is better than medication is because it's trying to help you overcome the underlying causes of your sleep problems or to manage them, rather than just treating the symptoms and trying to get you to fall asleep. And so the cognitive side of cognitive behavioral therapy is trying to teach you to recognize and change your beliefs that are affecting your ability to sleep. Like I said at the beginning, it is okay to wake up once in a while during the night. It doesn't mean you have a sleep disorder, but other more complex thoughts and behaviors that might be impacting your ability to sleep. And then behaviorally, it's trying to help you develop good sleep habits and avoid behaviors that are keeping you from sleeping well. So to identify, are you drinking too many cups of coffees? Very personalized, figuring out what behaviors might be exacerbating your ability to or inability to fall asleep in your sleep problems. So I'm going to leave this up here for a minute, but this is a checklist to see if it's likely you may have one of the sleep disorders that I mentioned on the list. Snoring loudly is often a sign of sleep apnea, as well as gasping for breath during sleep is a sign of sleep apnea. If you fall asleep or doze off while watching TV, reading, driving, or even engaged in simple daily activities, that is a sign you are not getting enough sleep. It is not, even if you're sitting in a boring meeting, hopefully not now, but if you're sitting and are dozing off, boredom doesn't make you sleepy. Boredom makes you bored. If you're fully rested, unfortunately, you're going to stay awake during that boring meeting. But if you're falling asleep, there's a sign that there's insufficient sleep, and it may be due to a sleep disorder. It may be due to if you're only allowing yourself 4 hours in bed to sleep, that's also going to cause insufficient sleep. But that is a sign of insufficient sleep. If you're having trouble falling asleep, waking up way too much and staying awake and can't get back to sleep 3 nights a week or more, that's also a sign of a sleep problem. That shouldn't happen that often. In acute periods of high stress, either work or other reasons that might be particularly stressful, you may understand why why you're not sleeping well. But if this continues for months, long past the period of time when there's high anxiety, then that's a sign you might want to seek help to manage the anxiety so that you can sleep better. If you feel those unpleasant, tingling, creepy, crawly feelings on your legs at night when you're trying to sleep, that's a symptom or a sign of restless legs that you should discuss with your doctor, because there are specific treatments for RLS. And then if you're having any interruptions to your sleep, there's other things that can interfere with your sleep that aren't specifically sleep disorders, such as nighttime heartburn, or pain. Any of these things can disturb your sleep and should be addressed so that you can get a good night's sleep. Well, why is sleep important? I assume if you're all here, you already think sleep's important, but there's a lot of things that happen if you don't get enough sleep. So sleep's here in the center of this picture, and then the circles represent different domains that have been linked to sleep, from cognitive function. I talked about brain upkeep early on, metabolic and endocrine function, cardiovascular function, immune function, mental health. And then on the outside are all these factors that are downstream of that. So everything from quality of life, memory and learning, diabetes, hypertension, cancer, obviously, anxiety, depression. Sleep has wide-ranging effects, and getting a good night's sleep, it plays a really important role in the quality of life and our well-being. So I do think sleep does a body good. All right, so let's end with some tips that might help you with sleep. Again, I mentioned earlier, I'd bring this up again. This is again the website with sleep information available from the National Institute on Aging. And again, you can just Google NIA sleep aging. There's even more information and additional tips there that you may find helpful. So what are some tips? Avoid caffeine. If you're having trouble falling asleep, you should try to, and you drink a lot of coffee or soda or tea, black tea, I would recommend you try to cut back. I've actually had many people tell me, oh, yeah, I have a lot of trouble falling asleep. And I ask them if they drink coffee in the afternoon or evening. Oh, yeah, but it doesn't bother me. But you just told me you can fall asleep. So I think sometimes people don't connect the two. So that's the first place to look if you're drinking a lot of caffeine and having trouble falling asleep. I recognize that sometimes it's a vicious cycle. You didn't sleep well, you're really tired, so now you want some caffeine, it'll pick me up, but then you can't sleep well. So basically, you just have to pick a day that you know you can stay at home and not have to get a lot accomplished, where you can just recover from and withdraw yourself from the caffeine. Alcohol is one that has gotten a reputation of being a sleep aid or a nightcap to help you sleep, but actually it actually impairs your sleep. So it is definitely something to avoid if you don't feel you're getting a restful night's sleep. And nicotine as well, it's a stimulant. So of course it's not going to be good for sleep. If you are a smoker, to try to not smoke too close to bedtime. I also had someone I knew that was quitting smoking and using the nicotine patch, and for some reason thought the best time to put it on was right before bed, and then wasn't sleeping very well. And then I pointed out, perhaps you should put that on in the morning. So just again, the disconnect sometimes that just happens with individuals to think about. So these are some things to avoid because we know they impair sleep. Establish a regular sleep schedule. So this is the idea of having as much as you can. Well, life gets in the way sometimes, but as much as you can to try to aim to have a regular bedtime, because this is really helping to set that clock I talked about at the beginning, your internal biological clock. If you're going to bed around the same time every night, exposing yourself to light and then dark around the same time every night, it's helping to synchronize your clock. If you're jumping all over the place, then your circadian clocks are just like, I don't know when I'm supposed to go to sleep. So trying to have a regular sleep schedule does help to synchronize your clock and makes it easier to fall asleep at the same time, more or less every night. Establish a regular bedtime routine. Now, parents are often encouraged to develop some kind of bedtime routine for their toddler, their infant, to help transition their toddler from being an active, crazy toddler to going to sleep. a book, a bath, a song, whatever it might be. But then for some reason, as adults, as we grow up, we think we don't need that anymore. Well, it turns out we actually do too. We need to have a period of, may not be a song, I don't know, it's up to you, but we need some period of transition between being awake and being asleep. It's not a switch we just flip and we go from wide awake to sound asleep. So establishing some bedtime routine that helps you relax and transition from a busy or wake day into a sleep, that's something that's relaxing and calming. Now, this is going to be very personalized. One person might find something relaxing that somebody else does not. But you can identify, like, if you, this 1 hour period where you dim the lights or maybe read a book, something that's, take a bath, take a shower, whatever you find calming to transition from the waking day to the sleep at night. Don't eat or drink a lot, but going to bed really hungry is also not so good. So maybe a light snack if you feel like you're going to be too hungry, and avoid bright light right before bed. That's a circadian signal to wake up. We don't want that. We want dim lights. I'm going to talk about that in a little bit more. Make your bedroom sleep friendly. You want your bedroom to be as quiet as possible, as dark as possible, preferably cool but comfortable. So we say somewhere around 67, 68 degrees seems to be a good temperature for sleep. Avoid watching TV or doing work in bed. You want your brain to associate bed with sleep, not with anything else. So you want your bedroom to be as sleep friendly and sleep focused as possible. Don't sleep with the TV on. Don't leave lights on if you can avoid it, because those wake your brain up. Even if you find it comforting at some level, it's still disruptive to sleep. I mentioned this before, and it's worth mentioning again, to avoid these bright electronic devices before bedtime. They're very common. They're in all our rooms with our smartphones, our tablets. It's bright light into our eyes, and it's sending a signal to our brain that we should be awake, when in fact what we want to be doing soon is falling asleep. And one of the things it's doing is suppressing this hormone called melatonin, which is an important hormone involved in the biological clock side of regulating sleep, because it's a signal to the brain, hey, it's nighttime, it's dark out, let's go to sleep. But if you're suppressing it, the brain's not getting that signal. And studies that have actually tested this in individuals do find that if people are looking at the tablets or the smartphones before bed, it takes them longer to fall asleep. It reduces how much REM sleep they get, and they're much less alert the next morning. So as hard as it might be to put the phone and the tablets down, as part of that bedtime routine, if you can minimize how much light exposure you have, that will help improve your sleep. All right, so this is my last slide again, because I want to make sure you have this resource. Please check it out if you want more details, or if you've forgotten anything I've said here. I do want to mention my colleagues and I are interested in studying sleep and aging. So we have the DISCO study. The websites are there if you're interested in checking that out as well. And I would love to take your questions now. And drink some water.
Thanks so much, Kristen. Do folks have any questions about specifically some of the things Kristen reviewed, or